The cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hi, Rob. Thank you.
Anytime.
So that woman declined treatment for the blood clot. So she came in with a little swelling of her leg. I recognized it. I sent her for this simple test called a duplex. The test came back positive the same afternoon. She declined treatment. She didn't like the idea of treatment, which is some form of blood thinners or something like that. Sometimes there's something called a Greenfield filter, which is a little filter that goes into the big vein that's located between the legs and the lungs to try to stop a blood clot so the blood clot doesn't travel to the lungs and cause symptoms or fatality, death.
Wow.
And then she went on a trip out west to Arizona and developed a massive blood clot on an airplane. And, of course, airplanes are known for that as well. She already had a blood clot, and airplanes are dehydrated. There's not enough.
And the longer the trip, the worse.
Right. They're worse because you're seated, so you're not moving very much. And also there's not a lot of humidity, the normal amount of humidity in a plane, so it's dehydrating to the body. So it makes the blood more viscous. So between sitting and the dehydrating effects of the flight, she developed a massive blood clot. This is now weeks ago, and she came in for treatment now and has tremendous swelling of her leg, and actually was in a wheelchair. She's always been ambulatory. So she is on treatment for that. We got her support socks to try to limit the amount of swelling in the leg, and that's helped her.
Wow.
When she comes in, I put her foot up on a armrest of a chair to get her foot higher than her heart, use gravity to try to get the swelling down to the leg. But there are recommendations for patients who have cancer to try to avoid blood clots because they are one of the top killers in cancer patients. And the recommendations included that hospitalized patients with cancer should get prophylactic treatment, which means low-dose treatment to prevent blood clots throughout the hospital stay. If you're outpatient and ambulatory, you're up and around, you probably don't need any treatment, even though you have cancer.
What about aspirin?
Well, that's one of the drugs that can be used. People with myeloma, which is a kind of cancer of the bone marrow of a particular line of blood cells, and who receive special types of anti-neogenesis agents, should be given treatment because their risk of blood clots is so high. Patients undergoing major cancer surgery should undergo prophylaxis before and at least 7 to 10 days after the surgery. And people with high risk should actually have prophylaxis for a month afterwards.
And just to be clear, because when I hear prophylaxis, that just means taking a medication to, maybe you could just say it again.
Prophylaxis means to do something to prevent something else.
Okay.
So prophylaxis means, in this instance, for example, to use heparin or aspirin or blood thinners to prevent or to reduce the risk of blood clots.
Okay.
So they're talking about in high-risk people in the hospital with cancer or certain diseases like myeloma, taking certain chemos to be on prophylactic treatment. It's not used, and some people have been trying to use blood thinners, let's call them blood thinners, to extend their life, thinking that the blood thinners will interfere with cancer cells sticking to various parts of the body. Well, that's a theory that's never been proven, and we obviously want to try to avoid treatment that's never been proven. So it is not recommended to take blood thinners if you have no particular reason for them. They will not extend your survival based upon the cancer. They may extend your survival based upon the blood clot, which is very different.
True,
So,
or end up causing some sort of stroke if someone's trying to self-treat themselves with
Well, that's
blood
right. If you're
thinners.
on blood thinners and you fall down, you can bleed in the brain or hurt yourself. Can be devastating. So the symptoms people should look out for: swelling of a leg or both legs is a very important sign or symptom, and I would encourage doctors to see that patient immediately. I certainly would, and get a test done immediately, and to emphasize to the patient how important that is. Other symptoms: what happens if the blood clot goes to the lung? Well, you can have shortness of breath, and sudden onset of shortness of breath or pain when you breathe may be a sign of a blood clot, and specialized tests need to be done emergently for that condition. You need to diagnose it before the patient may have a massive blood clot and succumb. It's estimated that blood clots may be the number 2 killer in cancer patients. Number 1 is the cancer itself, and number 2 is blood clots. So it's a very serious matter that we're talking about here.
Yeah, I heard also one of the signs that you have a blood clot that's on its way to the lung is a sudden drop in blood pressure. Is that correct?
Well, that's actually when it gets to the lung, because it stops up the blood from going to the lungs. There's going to be massive blood clots, which makes the heart is basically a pump. It makes the blood back up. Not enough blood's going to the lungs, so they're short of breath. There could be hypotensive, which is low blood pressure, or many people just die. The first sign is death. So it's really, really important to check this out and to take these signs seriously. Speak to your doctor about it, and go to the emergency room, day or night. If you have leg swelling or shortness of breath, please seek attention immediately. I certainly tell my patients that to call me day or night. We're just about done for this show. Unfortunately, it went really fast. We're on twice a week on WOR at 6 to 7 a.m. on Sundays and 9 to 10 p.m. on Sundays. Rob is my co-pilot here, and he's fantastic. I've worked with Rob for many, many years. We have a booklet that we offer to patients that want that. If you don't want to have your voice on the radio but want to ask your questions, please call me at 212-CHOICES, 212-CHOICES, which is our office, and I've tried to answer all your questions or meet you in person. Obviously, for people that want a fresh second opinion, it's best to meet, examine the patient, review the records, and try to see things in a different light to help the patient in a different way.
That about wraps it up. So I guess if you see St. Peter, it's too late.
We don't want people to see St. Peter until they're about 120 years of age. So we appreciate all the listeners on WR. We also have a show on WABC Saturday mornings at 6:30 to 7 on 770. And these two shows on WR, which are most important. So thank you, and have a great week.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.